Next on Health Matters, we have Dr. Halleck from the Psychology Institute, University Wilcoxon, joining us via satellite. Welcome to the program, Dr. Halleck.
Good morning.
Dr. Halleck is Professor of Behavioral Research and Therapy and an expert in understanding negative emotions and their impact on our health. When we talk about negative emotions affecting health, we mean anger, frustration, and those kind of things, don't we?
That's right. Negative emotions cover a range of potential feelings: anger, resentment, fear, or depression. They are complex psychological and physiological reactions to our environment, which are entirely normal and are also healthy responses to certain events. They can, however, become problematic when they stop us from enjoying a happy and healthy life.
For example?
Well, anger can be a cause for concern when an individual channels negative emotion into violence, be it self-harm or hurting others.
I see. And what kind of events typically provoke negative emotions?
It's difficult to say, but put simply, they are responses to events which we obviously understand to be unpleasant. I often work with people suffering from trauma. People who may have been bullied or abused at school, people who are terminally ill or grieving for a loved one, or just people suffering from work-related stress.
So you mean experiences that are normally associated with negative feelings?
That's right. Negative emotions can be caused by a complex range of factors, but the important thing is that the individual understands that something is not right in their life.
Is there anything that we should or shouldn't do when it comes to dealing with negative emotions?
My main advice is not to keep thinking about the problem over and over to the extent that the problem grows and becomes exaggerated. This doesn't mean ignoring the issue, but developing coping strategies, such as asking yourself questions. Is it really that bad? Am I magnifying the problem by worrying about it? At the same time, these emotions are telling us something is wrong, so we need to listen to them, and we may need to consider making changes to our lives.
Any other advice?
Yes, we might want to recognize that certain situations or people are going to cause negative emotions, so we can anticipate and prepare for them in advance. This can help us cope better.
Right, so we need to prepare ourselves in these cases.
Exactly. Above all, we need to try and understand ourselves better and take charge of how we feel. Sport, meditation, having fun, and talking to others can also help. Still, if we're really not coping, we should think about seeking professional medical advice.
Well, Dr. Halleck, thanks for talking to us today.
You're welcome.